If you're born today, you have a 1 in 3 chance of developing diabetes. Diabetes is the leading cause of adult blindness and kidney failure in this country. And diabetes is a leading cause of heart disease, strokes, and amputations. It turns out it's one of the Achilles heels of our species.
High blood sugars, when unattended, do terrible things to blood vessels. The number of people that we see every day at the University Hospital having coronary bypass graft surgery is legion. And regrettably, we see many people with type 2 diabetes and type 1 as well, who have gone on to destroy their kidneys.
I'm a firm believer you cannot die from diabetes. You die from abuse of the organs. I've had 2 amputations. I've had open heart surgery and retinopathy with the eyes. I've been lasered, so there's quite a bit of abuse of organs.
I've been the principal investigator of the Yale Center in the Diabetes Control and Complications trial. That study started in 1983. Almost every person who enrolled in that study 30 years later is still coming back. And what we've shown is that controlling your diabetes can prevent a lot of these complications. Not only the small blood vessel complications that you see in the eye and the kidneys, but also the things that kill you, like heart attacks and strokes.
As a society, we could save billions and billions and billions of dollars if we had screening techniques to find it early when it's mild and more fixable than to wait to the very end when you pay for heart surgery, dialysis, amputation of limbs, and blindness.
To do the blood sugar tests total about 8 times a day. When I get the low blood sugar, I come into a sweat, become weak, slurred speech, vision.
Good self-care of diabetes begins and ends with knowing your blood sugar levels.
The task of pricking your finger, having a lancet, a needle thing that actually goes through the finger, having a drop of blood, having your meter and your strips and doing all this, it's a tough job, and it's a job that doesn't end. You have to do it 5 times today, you're gonna have to do it 5 times tomorrow, you do it, 6 times the next day.
You can be the mother of a 3-year-old child with that terrible experience of having to prick a child's finger, or you can be some gentleman trying to earn a living at age 55 and hold on to a job and still have to be pricking the finger with a steel lancet 4 times a day.
I check because I feel better when my blood sugar's in range.
Many totally intelligent and motivated people who happen to have diabetes, type 1 or type 2, simply do not test the blood sugars sufficiently during a day. There's a natural reluctance.
A classic difficult to manage patient with diabetes is children as they move from childhood to adolescence to adulthood.
They don't want to feel different from their friends. They don't want to have to open up their kit, take out a meter, wipe their finger with an alcohol swab, stick their finger with a lancet, and then check a blood sugar. They're doing this in their cafeteria at school, then they're going to drop their syringe and give an injection. They don't want to feel any different. They're concerned where they fit in socially in their groups, and they don't want to have to feel different.
Most juvenile diabetics, they experience what's called burnout, and it's just you get sick of doing the typical diabetes stuff every day. You just kind of abandon taking care of it and throws your blood sugars all over the place. I went through that probably a year or 2 ago. There'd be days where I wouldn't test at all. When you don't take care of your diabetes, your body chemistry is all thrown off. You get really lethargic, really weak. Your body starts eating away at itself, and it's just very harmful altogether.
Diabetes is growing by leaps and bounds. I work with people in Southeast Asia. They're seeing a huge increase in diabetes, in complications of diabetes. In India, 10, 15 years ago, they used to say that they had the largest number of diabetics in the world. China, the same thing. It's going to place a huge burden on governments, on healthcare infrastructures everywhere, and on the resources of societies, may hamper the overall economic growth of the world.
Continuous glucose monitoring is one of the technological advancements that's revolutionized diabetes care.
I do like having the CGM. I don't like having to wear something. I don't like the actual device. I like what it gives me. I'm able to see trends. I'm able to see if I'm rising. So I've stuck with it simply because the data is just so valuable to me.
When I start a patient on a continuous glucose monitor, I extract from them a pledge that they won't throw it against the wall or throw it out the window until they've worn it for at least a month.
We've had meters and strips available to us since the early 1980s, more than 30 years. What I think people have been looking for is some sort of disruptive, transformational improvement in technology that gets to something different. And that one of the holy grails in this is a non-invasive method. Just like in the hospital where they put that little thing on your finger and it tells you what your oxygen concentration is without actually having to have the blood. That's the kind of thing that people would really be excited about.
I guess if it could be just as easy as sending a text message would be ideal. If I could whip a blood glucose meter out like a phone, put it on my skin or whatever, and then have it show me my blood sugar, I could calculate it there.
If I had the opportunity to stand on a soapbox and give some message from the heart to everyone involved with diabetes, those who have it, the families of their loved ones, or providers or physicians or nurses, test often. Look at the numbers, act on your numbers, and as many times as you can test during the day, it is to your advantage. And that is the hope of technologies which may come over and above sensors.
Grove Instruments, leading the non-invasive revolution in diabetes monitoring and management.